to Health Beat. I'm Dave McDowell, and today we're going to look into the law with respect to immunizations for school-age children in the state of Michigan and Macomb County. I'm going to talk about this with a Macomb County resident who's both a healthcare professional and a parent of school-age children. I'm here at the Health First Chiropractic Clinic in Sterling Heights with Dr. David Pflaum. Dr. Pflaum, can you tell me, what are your credentials with regard to children's health and more specifically children's immunizations?
As a doctor, I've got extensive training in toxicology, immunology, anatomy of the human body, public health, and exactly what makes people well and what makes people sick.
Why is the law an issue? Why shouldn't parents just immunize their children consistent with the schedule that's provided by the local health department?
Well, I don't think the question is whether to or not to immunize, but more so when it's appropriate.
And do you have some ideas on when it is appropriate?
Well, I was in industrial medicine for a while before I became a chiropractor, and I was surrounded with high-risk individuals for hepatitis. That would be contracted by me getting poked by a needle or a coworker poking me by a needle after it was used on an intravenous drug patient or someone with antisocial behaviors.
Do you have any ideas when it's inappropriate to vaccinate?
Well, according to the Center for Disease Control, newborns, their first shot is a hepatitis shot. Now, as high risk, I don't think my newborn is hanging around these high-risk individuals. So is it appropriate?
Now, what is the law with regard to immunizations? Is it mandatory in the state of Michigan or in Macomb County for a school-age child to be immunized?
Mandatory, that's a good question. It's very confusing when it comes to the law because the first part of the law states that a principal or a teacher can refuse to teach your child if they do not have the required immunizations.
That sounds pretty mandatory.
Sounds pretty mandatory. Now, there's a second part of the law. In fact, the second part of the law states 3 reasons why you don't have to, and you can sign a waiver form with these 3 reasons.
And what are those 3 reasons?
First would be medical. If your child has had any reaction to any vaccination previously, it would be contraindicated to vaccinate your child again.
What's the second reason?
The second would be religious. If your religion deems it inappropriate to vaccinate, then you don't have to.
And then what would be the last?
The last would be philosophical. If you really don't think that there's enough, if you don't feel that you're educated enough or that there's enough information provided for the safety of that immunization, you don't have to immunize.
Suppose that you were going to use one of these exemptions. What procedure would you follow to get your child into school without immunizing?
Well, I'm glad you asked me. Since I have a 4-year-old that I just registered this past fall, I went into the school. I wanted to register my child. I had everything filled out. And then I asked them for a waiver form. Now, they gave me the Macomb County waiver form. I put my reasons why I thought that it was inappropriate for my child to get the immunizations. I filled out the form. He was enrolled in school. It's as simple as that.
I want to thank Dr. Pflaum for appearing on this show. Dr. Pflaum's opinions are not necessarily the opinions of this program or this station. In order to help you educate yourself about immunizations, I'd like to direct you to a few informational websites. First, the Center for Disease Control. That site is www.cdc.gov/vaccines. Second, the site for a group called Mothers Against Mandatory Vaccinations is www.momvaccines.org. Finally, if you have any questions about anything Dr. Pflaum said today, his website is www.healthfirstchiro.net. This has been Health Beat with Dave McDowell. Thanks for watching.